Hi, I'm Dr. Ari Garfinkel, owner of the Smile Garden, and we take great pride in talking to patients not just about their dental care, but also about their overall health and wellness. And a big time that conversation comes into play is when we're talking about gum health. And so when someone is having issues with their gums and the gums are inflamed, sometimes that can turn into periodontal disease where the bone levels are starting to be affected. And unfortunately, that can have repercussions for people throughout the rest of their body. And so when we have a lot of bacteria in the mouth that is starting to eat away at the bone, that bacteria is also being swallowed and affecting their digestion. It can also be leaking into their bloodstream and traveling to other organ systems in their body and affecting their body in other ways that they might not be aware of. And so we want to make sure that we're taking the time to talk about some of those risks and concerns and talk about treatment options to help not just their mouths be healthy, but also the rest of their body as well. So, when we're talking to patients about gum disease, we really want to be solution oriented. And so, we want to talk about ways to improve our habits. So, good brushing, regular flossing, regular dental cleanings are a great way to treat the inflammation in people's mouths that's affecting their gums, maybe sometimes their bones. And we want to make sure that we are working towards getting healthier mouths, but also healthier bodies so that we can feel better. So, when we are doing our comprehensive exam with patients and even regular checkups, we make sure to measure the gums and check on the health of the gums. And so, you'll probably hear me call out numbers to my assistant. So, when we talk about numbers, one, twos, and threes are healthy. Fours and above is telling me that there's inflammation involved. We'll also talk about what bleeding is there and if I'm seeing a lot of buildup in certain places, and talk about ways that we can make sure that you're cleaning it better and so we're not letting that bacteria build up around the teeth and the gums to help decrease that inflammation. We'll also get you scheduled for a cleaning so we can get all that gunk off ourselves and make sure you are ready to go and work on your brushing and flossing habits so we can keep you healthy and going strong. So, oftentimes, the early signs of gum disease are that your gums are bleeding and they just hurt. I hear a lot of times that patients say, well, I would floss, but it really hurts when I do it, or it just bleeds a lot. And so I don't feel like doing it because it's such a mess. And unfortunately, that's usually a sign you need to do it more. And I understand how hard it is to get in there with the gums when it really doesn't feel good. But usually, if you keep going with your flossing, if you floss every day for 2 weeks, you will remove that inflammation and then come in for a cleaning so we can get all that gunk off and we can help you feel better because gums should not hurt when you floss them or brush them and they should not bleed. So those are usually signs that something's not right and then we want to talk about it. When patients are ready to get their gum disease treated, we talk about different ways to make sure that they're comfortable. We understand that when gums are inflamed, they hurt. And so we want to make sure that we numb those gums to make people feel comfortable when they're getting their treatment done. We can do that with local anesthetic shots, or we can use a rinse that helps numb the mouth. And so the rinse kind of takes the edge off, but it doesn't necessarily mean you won't feel anything. The shots, though, will take away all the pain and you really won't feel anything. But I understand that some people don't want all those shots. And so that's why the rinse can be a really nice option to help take that edge off. I love when people who had gum disease are able to turn their habits around, turn their lifestyle around, start coming in regularly, and are really able to make their mouths healthy again. And so I've had so many patients over the years that have been inspired after getting that gunk off their teeth. They look nice and clean again, and they feel better. It's amazing how many people just feel more energized and feel better in their bodies when they don't have all that bad bacteria sitting on their teeth. They're swallowing that bacteria and it's affecting their digestion and just their overall health. And people just so often just have an elevated level of energy when we get that bad bacteria out of their systems. And they love flossing. Can you believe it? It's amazing. People end up loving flossing because they know that they're helping their mouths and helping their bodies and helping themselves live longer, happier lives. So, gum care is really overall health care as well. And so when we talk about taking care of our gums, of course, we want to talk about regular flossing and regular brushing and regular dental visits. But we might also want to talk about taking a probiotic that adds good bacteria to the system because bad bacteria has been swallowed and been flowing in the bloodstream for a long time. We also want to talk about good nutrition and making sure that we are not snacking throughout the day and making sure that we are allowing the mouth and the saliva to come in and help clean out the mouth, rinsing with water. We don't really want to be sipping on coffee all day and keeping that mouth acidic and a favorable environment for bacteria. We also might want to talk about some other supplements that we could help sort of tamper down the immune response that's happening, especially when periodontal disease is affecting the body. And so we might also want to talk about zinc, which helps boost up the immune system, maybe some turmeric to help decrease inflammation. And so there's lots of things we can talk about to help the body deal with and treat the periodontal disease that is in the mouth. So, if someone hasn't had their mouth or their gums checked in a while, I would encourage them to give us a call so that we can sit down and talk about what's going on in your mouth and show you what we are seeing. And we'll talk about what are some of the risks of not doing treatment, but also what are some of the benefits if we do start cleaning the mouth and start improving our habits, and how you can help yourself feel better overall and help your overall health.